What is implantation failure? Actually, it is a very broad term that essentially the IVF fraternity is moving away from, because it is crucial to understand that a proper implantation failure is defined as 2 or more failed genetically embryo transfer cycles that have not worked. I don't like to use the term negative or an unsuccessful outcome, but unfortunately, if a cycle does not work, it means that with 2 or more genetically normal embryos, this could be classified as an implantation failure, where further investigations may need to be done, of course, appropriate to your history. There are an umpteen number of causes of implantation failure. Could be autoimmune conditions, could be thrombophilic conditions, which is an inherent capacity to overclot than underclot, or it could be a silent endometriosis that actually has not been picked up in your previous cycles, or it could be actually the quality of the embryos are very poor, and therefore that has resulted in a failed cycle. It is important to reach out to any of our consultants who would then actually decide what is the best investigations for you suited as a couple. Pre-implantation genetic testing on embryos has actually revolutionized success rates in the IVF world. And essentially, if there is a technique for us to improve ongoing pregnancy rate, but very importantly, decrease miscarriage rate, which is devastating for us individuals going through an IVF cycle, then that is an optimum option for couples to consider. What is pre-implantation genetic diagnosis? Is actually evaluating the genetic status of that particular embryo. And what it also does is, very importantly, reduces the time interval for you to get pregnant and deliver a healthy baby. The most effective treatment for successful implantation, there is not one step that does it all. And I believe that this is a combination of steps, i.e. 1, getting the right embryo. Number 2 is preparing the lining of the uterus, and essentially using add-ons like embryo glue or an intrauterine HCG or a human chorionic gonadotrophin flush, which may be appropriate for you, may be used in order to accentuate success rates. But please reach out to any one of us here at Aria.